Why is using the correct introduction and greeting so important in the OET speaking exam? How do you know which greeting to use? How do you know what to call the patient? Don't ignore the vital information in today's video, the OET speaking test, introductions, greetings and conclusions, pass or fail. Hi, my name is Richard Foster. I'm a trainer and assessor for Benchmark Education Solutions. Today we're going to talk about how truly understanding the best greetings to use, the best introductions and the best conclusions to use, and how learning that the background information about the patient directly influences the way you greet the patient, the way you speak to them, and the way you conclude the conversation. It also covers things like, or influences things like, whether you know the patient's name already, whether you need to ask for their name, or maybe the fact that you know the patient is already implied in the Roleplay card. Now, before I go over to my computer, it's worth mentioning that, again, everything we cover in today's video is the sort of thing you need to be thinking about during that first 3-minute prep time for the exam. So let's get started. Let me take you over to my computer and I'll show you exactly what I mean. Okay, here we are at the computer screen. So let's just remind ourselves, we're going to focus on the importance of getting the greeting, introduction and conclusion correct and right. So one of the questions that often comes up is, how do I know the patient's name? What shall I call them? How shall I address them? Well, there's a simple 2-stage process that you can go through to understand whether you know the patient's name or not, or you're supposed to know the patient's name or not. The first thing is, look at the setting. Does the setting indicate in any way whether you already know the patient or whether you need to find out their name? In this case, it's a city centre general practice. Well, it could go either way, couldn't it? Because in general practices, you will often have a mix of new patients, existing patients, patients that maybe you haven't seen for 2 or 3 years, patients that you saw 2 weeks ago, etc. So it could go either way. So the setting in this instance doesn't really give you an indication as to what you should call the patient, how you should address them, whether you know their name or not. So we need to move on to the background information about the patient. Now, the Roleplay card may say something like, this is a follow-up appointment, or during a follow-up appointment, you discuss X, Y, or Z. In this case, that will indicate that you know the patient and the chances are you've seen them very recently. It may also be that the patient is returning for tests or something like that. Again, there's an indication that you know the patient already. If that's the case, it doesn't then seem appropriate to ask the patient for their name, does it? So in that case, it's quite acceptable to make up a name. So if the Roleplay card, the background information indicates that this is a follow-up, or maybe the patient's coming back for some tests, or you saw the patient a week ago and they've called you for some more advice, for example, in that case you might say, let's make up a name. Now, if you make up that name, the interlocutor will simply go along with it. Now, in this case, there is no indication that you have met the patient before, or indeed that you've seen the patient recently. In that case, it's quite appropriate to either make up a name, which is one option for you, or you can go ahead and ask the patient's name, which in this case is the more appropriate approach. So in this way you might say, hi, my name is Richard Foster, I'm one of the doctors on duty today. Please come in and have a seat. Can I ask your name, please? Now the patient gives you their name. Now, you'll also notice in this roleplay that there's a second person in the room. In this case, it's a 2-year-old daughter. If that's the case, then you also need to introduce and greet that second person. Again, remember you're gaining marks for introductions and greetings. So in this case, okay, it's just a 2-year-old daughter, but you might say to the parent or the person that's brought this young child in, you might say to them, and who is this young lady you've brought with you? Oh, that's my daughter, Lucy. Oh, hi, Lucy, nice to meet you. Do you see the point? You are greeting and introducing both people in the room now, and for that you're going to gain marks. So do you see, it's actually a really simple process. The setting will give you some indication whether you know the patient or not, but the role play card background information about the patient really should conclude and make that clear for you. Again, if the role play card doesn't give you any information, then it's also quite okay to make up a name. But let's look at a variance on this. Let's go to an emergency department. Do you see this point here? The setting is the emergency department. So what's most likely to be the case in an emergency department? Would you know their name already or not? Well, of course, it's most likely that you do not know their name. The background information about the patient will give you some indication as to whether this is whether the patient is unconscious or something else that will prevent you from getting the patient's name at this stage in the conversation. But in this case, it says that your patient is a young parent, 26 years old, who fell down at home and hit his or her head and has now presented with quite strong headaches. The fact that it's an emergency department should already give you an indication that you do not know the patient from before. In that case, again, you can do one of two things. You can either pretend that you have access to their record, their admission file, or, what's more appropriate, simply ask the patient's name. Hi, in this case it's a nurse attending. Hi, I'm Nurse Foster, I'm one of the nurses on duty today. Could I ask your name, please? That way the patient immediately gives the name. And one of the points now, having got the name from a patient, whether it's a general practice or in this case an emergency department, once you've got the person's name, you may wish to ask, is it okay to call you Richard, or would you like me to call you Mr. Foster? You know, you might say something along those lines. But do you see, the setting may give you an indication, but the background information should really back up your intuition as to whether you know the patient's name or not. Let's just look at a third variation on this. This is a hospital ward. So let's follow that same process again. The hospital ward. Does the setting give you any indication as to whether you already know the patient's name? Well, of course, it's most likely you do, because this is a hospital ward. The patient may have been there for some time, or may have only been there since yesterday or the day before. But the point is, you have access to their chart. You may have done a handover from the previous shift, who will inform you about changes on the ward. So again, right now the setting already indicates that you probably know the patient's name. Now, how do you greet then a patient on the ward whose name you already know? Well, in this case, it's a simple matter of making up a name. You can say, being as you're the nurse attending on the patient who has undergone an operation for partial thyroid gland removal 1 day ago, you might simply say to the patient, "Hi, Richard. You'll remember me. I'm the nurse on duty today. My name's Richard. Can I ask how you're feeling after your operation yesterday?" And in fact, I mentioned the name Richard twice there. But do you see the point? You can simply make up a name. "Hi, John. How are you feeling after your operation today?" Or, "Hi, remember me? I'm the nurse on duty. My name's Richard Foster. John, how are you feeling today?" Do you see, now you know the patient's name, because the background information and the setting indicate that you do that. There is a slight hybrid that you can use, a kind of, what if I'm not sure? What if there's a little bit of confusion in the role-play card as to whether I know who the patient is? One way of doing that is, if you're not sure, maybe let's just go back to the doctor, the city centre general practice. It may be that you know the patient. It may be that you have access to their medical file. It may be that you have some notes that were made by your receptionist when the patient first made the appointment. If that's the case, but you're not absolutely sure, if you know, you can use a technique by pretending to make sure that your records are accurate. So you can say something like, Hi, my name's Dr. Richard Foster. Please come in and have a seat. And then you go through the greeting. You ask the patient's, just simply ask the patient's name. But what you can do is simply say to them, hi, nice to see you again. I just want to make sure our records are correct. Would you mind just confirming your name for me and your date of birth, please? Do you see what I mean? So if you do know the patient's name but you're not quite sure, then simply ask and make the excuse that you're just checking that the records are accurate. I hope that makes sense. Now, let's come on to the conclusions. It's really important that you conclude the conversation appropriately. Don't just leave the conversation hanging and leaving the interlocutor wondering whether you finished speaking or not. It's very important to give a very clear ending to the conversation. For example, you might say, okay, Richard, nice to see you again today. I hope that helps with the medication and the information I've given you today. And we've made an appointment for 1 week's time for a follow-up appointment. I hope that helps. Please, nice to see you today. I'll see you in 2 weeks. Do you see, just keep it simple. Or you simply might say something like, well, I hope that helped today, Richard. It was nice to see you. I'll see you in 2 weeks. Do you see the point? Make sure that you conclude the conversation in a very clear and definite way to indicate to the interlocutor that you have finished speaking. That's so important. So I hope that helped today. We've covered greetings and introductions, how important it is, how to discern whether you know the patient from before, how to approach that introduction and that greeting based on the setting and based on the background information about the patient. We've also discussed a kind of hybrid situation, just in case you're not sure whether you know the patient's name or not. And finally, we've discussed how important it is to make the conclusion very clear and very definite. Well, it was nice speaking again with you today. I hope it helps. We're really trying, as we've said before, to give you as much information as we can in order to help you pass the OET speaking exam. But you know, there's nothing quite like having a one-to-one session. As you know, Benchmark Education Solutions offer a mock test where under exam conditions, we will take you through an exam, but we will also give you personalized one-to-one feedback. By all means, check out the link in the video or in the notes below where you can make a booking with me and we can discuss this further. As I said, my name is Richard Foster. Next time we'll be speaking about the vital skills of echoing and summarizing and how it allows you, by using these skills, to gain more marks by covering 3 of the main skills mentioned in the OET exam criteria. These are giving information, gathering information, and checking the patient's understanding. Not to mention the fact that echoing and summarizing themselves are also things that will gain you marks during the exam. Now, we're adding these videos very regularly and frequently, so make sure not to miss any of these by hitting the subscribe button, hit the like button, but particularly, if you would please, hit the notification bell. This means that for one thing, we can continue to provide these videos for free, but for another thing, you will get notified every time we release a new one. So I hope that helps today. It's really been nice speaking with you. I'll see you in the next video.